All right, if you're deep in NCLEX prep, you know just how much stuff you have to cram into your brain. Today, we're going to laser focus on a super important and honestly kind of tricky area, nursing ethics and law. Think of this as your survival guide for those questions that go way beyond clinical skills.
So you've got the clinical skills down, right? You can calculate a drip rate in your sleep, you know your meds, you know your procedures. But are you ready for the questions that test your judgment, your character? That's the real test, not just on the NCLEX, but for your entire career.
Because let's be real, the toughest calls you'll ever have to make aren't going to be in a textbook. They're the gray areas, you know? The split-second decisions with huge stakes. So let's get you ready for that.
Okay, first things first, we need to calibrate your ethical compass. This is the bedrock of everything you do. It's what's going to guide you when you're not sure which way to turn.
This quote, I bet this sounds familiar to some of you. You're in your clinicals, you're trying to learn, and you see something that just doesn't sit right. It goes against everything you've been taught. That little feeling in your gut? That's exactly why having a rock-solid ethical foundation is an absolute must.
And when we talk about ethics, we're not just talking about a list of rules. We're talking about character. The word itself, ethos, it literally means character. So these principles, they're the why behind every single thing you do as a nurse.
Which brings us to your North Star, the American Nurses Association Code of Ethics. If you're overwhelmed, just focus on these first 3 provisions. They're your foundation. Number 1, practice with compassion for every single person. Number 2, your main commitment is always to the patient. And number 3, your job is to advocate for them and protect them. It's simple, but it's everything.
So you've got this code. What does it actually look like in the real world? Well, that all starts with understanding the patient's rights. Because your duties as a nurse and their rights, they're basically 2 sides of the same coin. First up, autonomy. And listen, this is a huge one for the NCLEX, so pay attention here. The bottom line is the patient is in charge of their own body. They have the absolute right to say no, even if you think a treatment will save their life. Our job is to educate, but ultimately we have to respect their decision.
Then you've got beneficence. It's a fancy word, but it just means to do good. It's not enough to just not harm someone. Our duty is to take active steps to help them. You know, putting up the bed rails to prevent a fall, making sure they get their pain meds on time, that's beneficence in action.
And that brings us to justice. Plain and simple, this is about fairness. Every patient, no matter who they are, where they're from, or what they can pay, deserves to be treated fairly and equally. This gets really tough when resources are scarce, like who gets that last ventilator? That's a question of justice.
So how do we make sure we're respecting patient autonomy? A huge piece of that puzzle is informed consent. And it is so much more than just getting a signature on a piece of paper. It's a whole conversation. You have to cover these 5 key points, and for the NCLEX, you absolutely need to know them. Okay, so what happens when things go wrong? When these ethical principles get broken? Well, that's when we cross the line from ethics into law. And this is where your license, your whole career, is on the line.
All right, get your highlighters out because this is a classic NCLEX question. What's the difference between malpractice and negligence? It really boils down to one simple thing: intent. Malpractice is when you know what you're supposed to do, the standard of care, and you choose not to do it. Negligence is more like an honest mistake or a carelessness that ends up hurting someone.
Now, for a patient to actually win a malpractice lawsuit, they have to prove all 4 of these things. Think of it like a checklist. Was there a nurse-patient relationship? Yep. Did the nurse fail to provide the standard of care? Yep. Did that failure directly cause an injury? Yep. And did the patient suffer harm because of it? If they can prove all 4, you're in trouble.
And hey, if you're sitting there thinking, well, I'm just a student, this doesn't really apply to me yet, think again. This quote makes it crystal clear. As a student nurse, you are held to a standard of care. Your actions in clinicals have very real, very serious legal consequences for you and for the hospital.
All right, let's shift gears and talk about one of the biggest, slipperiest legal minefields for students and new nurses today: social media. It feels like your personal space, but when you're a nurse, nothing is ever truly private. Let me tell you a quick and true story. There was a nursing student, and she had a 3-year-old patient who was just being incredibly brave during his chemo treatment. Her heart went out to him, and she took a picture. She posted it on her Facebook, wrote a beautiful caption about his courage, but she missed something. In the background of that photo, you could just barely see it, the patient's room number, a tiny, tiny detail that changed everything.
And the fallout? It was absolutely devastating. It was a clear HIPAA violation. The student was immediately expelled from her nursing program.
and the entire nursing school was banned from using that hospital for clinicals. One post, meant to be positive, ended a career before it even started.
So let's just get this straight and bust a few myths right now. 1. There's no such thing as a private post. 2. Hitting delete doesn't make it go away. Screenshots live forever. And 3. Not using a name isn't enough. If there is any piece of information that could identify a patient, it is a violation. Period.
Okay, we have covered a ton of ground, from big ethical ideas to the nitty-gritty of the law and social media. So let's pull it all together. How do you actually protect yourself, your patients, and your future career? And I want to be really clear about what's on the line here. This isn't about getting a question wrong on a test. We're talking about getting fired, being disciplined by the Board of Nursing, paying huge fines. We're even talking about potential jail time and the absolute worst-case scenario, losing that nursing license you are working so incredibly hard for forever.
So as you're grinding through those practice questions, remember this. Every single question about ethics, about law, it's really a question about your future. Your license isn't just a document. It's your livelihood. It's your career. And the only real question left is, how are you going to protect it?